Thank you very much, Mr. President. Mr. President, I met in my office here in Washington today with Donna, a Rhode Islander who suffers from vascular disease. Her condition forced her to give up her job, and because of that, she lost her insurance. She can't afford to buy insurance on her own since it would cost her $650 a month, and she doesn't have $650 a month. So she pays for her medications out of pocket. Those medications would be $2,000 per month, but thankfully her doctor has been able to talk the price down to $450. But even this is no walk in the park. Donna read me a laundry list of the procedures and services that she needs for her vascular condition but cannot afford. Like so many Americans, she sits waiting, struggling, and hoping that her health does not get worse. I want to tell my colleagues what I told Donna today, which is that the Affordable Health Choices Act, the bill that the Help Committee passed out of committee last Wednesday, would mean hope and change and help for Donna. It would mean that insurance companies could not deny her a policy because of her vascular disease, as they can and do now. It would mean that insurance companies could not charge her sky-high rates because of her vascular disease, as they can and do right now. It would mean that if Donna needed financial help to purchase a health insurance plan, she would get it. No pre-existing condition exclusions, affordable premium rates, and subsidies for those who need help purchasing a plan. That is what the Help Committee's bill offers every American in this country. I also heard from Madeline, a Pawtucket, Rhode Island resident who can't afford health coverage despite the fact that she works 2 jobs. Her family has a history of colorectal cancer. Both her sister and her mother lost their fight to that disease. Tragically, Madeline cannot afford to get a colonoscopy. Without insurance, Madeline waits and hopes that she doesn't get sick because that's the only option she has. Under the Help Committee's Affordable Health Choices Act, Madeline would have the financial help she needs to buy a comprehensive and affordable plan. But even before she did that, even before everything is in place for Madeline to go to a gateway and buy a plan, she could sign up for the Right Choices program. Under Right Choices, even without insurance, Madeline would have access to all basic preventive services. She would get a chronic disease health risk assessment, a care plan, and referrals to community-based resources. Most importantly, she would get the colonoscopy she needs so that she's not another victim of the terrible disease that took her mother and sister. And it goes without saying that preventing this disease and treating it early would, in the long run, save money for the healthcare system, as well as preserve Madeline's health. I recently had coffee with Shirley, a Middletown, Rhode Island resident, who described her relief at turning 65. For the past 20 years, she and her husband had no insurance. As self-employed business owners in their 50s, finding affordable insurance was just impossible, so they went without. They took their chances. Now 65, and in the safe harbor of Medicare, they finally have peace of mind. Shirley admits that she and her husband were lucky to make it through those 20 years without serious health problems. During our meeting, she urged us to pass health care reform for the millions of hardworking Americans, hardworking middle-class Americans who are not as fortunate as she and her husband. Under the bill that we passed out of the Help Committee, Shirley would not have endured 20 years of fear and uncertainty with no health insurance. As a self-employed small business owner, Shirley would be eligible for tax credits to either continue to offer health insurance to herself and her employees or to offer it for the first time. Shirley could also take all of her employees to the Health Insurance Gateway, which will give small firms a choice of multiple insurance plans at a lower cost, competitive with the same rates that the big companies can get, and of a higher quality than what currently exists in the small group market. If you are a small business owner, this bill is good news for you. Judith from Warwick has shared with me a story about her brother-in-law, whose lungs collapsed during an outpatient procedure. After staying in the intensive care unit for 28 days, he contracted a hospital infection and was re-hospitalized 4 times. Thankfully, a year later, he is symptom-free, but the costs stemming from that treatment totaled over $500,000. Like her brother-in-law, Judith and her husband are retired and live off their monthly Social Security check. She reflects that on such a limited income, if she or her husband faced a catastrophic health issue like her brother-in-law, they would be in dire straits. The Help Committee bill creates a Patient Safety Research Center at AHRQ, which will support research, technical assistance, and process implementation grants to local providers to teach and implement best practices. No one should go through what Judith's brother-in-law did. No one should contract a hospital-acquired infection that leads to not 1, not 2, not 3, but 4 rehospitalizations. We know how to prevent hospital-acquired infections. We have seen tremendous results in places like Michigan and Rhode Island for years. The Help Committee bill finally creates a national infrastructure to support the dissemination of these proven practices so that we can drastically improve the quality of care in our system, and in doing so, drastically lower the cost. Finally, I recently met David. He's a self-employed resident from Central Falls, Rhode Island, who described the astronomical rise in the cost of health insurance for him and his wife. He remembers years ago when he paid $85 a month for his plan. Today, he pays approximately $19,000 a year. Despite the dramatic jump in price, his family's health insurance plan doesn't cover as much as it used to. To keep their premiums and overall health costs down, David's been forced to drop dental coverage and increase the out-of-pocket expenses that he and his wife pay on their plan. He noted, "I'm almost afraid to get sick because today's health plans have so many holes in them, they can nickel and dime you to death." The Help Committee's Affordable Health Choices Act would do 2 important things to help David. One, it would require that the plans sold in the gateway offer a truly comprehensive set of benefits so that affordable does not mean skimpy. Affordable will mean inclusive, available, and accessible. 2, the bill would not allow insurance companies to nickel and dime you to death, as David fears now. Insurance companies would be prohibited from imposing lifetime or annual limits on the dollar value of benefits for any enrollee. So David will not be forced to pay out of pocket once he exceeds a certain level of benefits, as he does now. Mr. President, there is some uncertainty both in this building and around the country right now about the future of health reform. I want to remind everyone, my colleagues on both sides of the aisle, my colleagues in the House, Rhode Islanders back home, and Americans across the country, the Senate has already put forth a health reform plan that will work for you. It will work for small businesses. It will work for Americans with pre-existing conditions. It will work for Americans struggling to pay health care premiums. It will work for Americans who are one illness in their family away from a bankruptcy. It will work for Americans who are uninsured. It will work for Americans who have been the victims of hospital errors. It will work for Americans who now need preventive services that they cannot afford. Most importantly, it will work for Donna and for Madeline and for Shirley and for Judith and for David. It will work for their fellow Americans all over this country whose stories are all too similar. We have all heard them. Heartache, frustration, exhaustion, and ultimately really disgust with a healthcare system that has, at best, disappointed them, and at worst, turned its back on them in their hour of need. The Affordable Health Choices Act offers these Americans a hand up when they need it most, and I am proud to support it. Mr. President, I yield the floor, and I want to just take one moment to thank the distinguished senior senator from Iowa for his courtesy in allowing me to proceed. I know he has substantial remarks that he wishes to deliver, and I hope I was not too much of an inconvenience to him, but I appreciate his gracious courtesy, and I yield the floor.